Good morning to the students. Today I am giving a presentation on obesity as a silent killer. As you all know that there are so many silent killers like malnutrition, hypertension, diabetes, HIV, AIDS, and but other than obesity is another silent killer which is exist in our society from very long time, and whole world is in grip of this problem. Globally, there are more than 100 crores overweight adults, at least 30 crore of them obese, and almost 15% of the Indians are obese. It was found that 38% women and 30% men are obese in the Punjab. Individually whose BMI is between 25 to 29.9 kg are termed are overweight, and whose BMI is more than 30 kg are obese, whereas person with BMI more than 35 kg fall in the super obese categories. People with BMI below 18.5 kg tend to the underweight. BMI measurement obtained a dividing a person's height in meters exceeds 30 kg. If we talk about the symptoms of the body, these are the difficulty in sleeping, snoring, sleep apnea, pain in back and joints, excessive sweating, always feeling hot rashes and infection in fold of skin, feeling out of the breath, and we can say that obesity is one of the leading cause of death. Obesity is estimate cause of the 4 lakh death per year in the United Nations alone. Obesity is spreading very fast even in the poor country like India. If it is not controlled in the time, it will create serious problem for all of us. Reasons of the obesity, we can enlist that more calories, less exercise create fat in body, genetic problems, and get up late in the morning, came to home at the late hours, skipping food, insufficient sleep, watching TV more, after delivery taking too much fatty diet, IVF treatment, taking hypertension medicine which increase hormonal levels. After menopause, hormonal changes also the reason of the obesity in the women. In old age, problems like arthritis, joint pains, ladies decrease their activities. Watching TV more is also one of the major reason for the obesity in the children. And you can say that the social and economic factors are our rising standards of the living and greater free time. Psychiatric problems, pregnancy, later age are also the cause of the obesity. If we are talking about the serious health risk problems, these are the blood pressure, lipid abnormalities, cancer of uterus, cervix, ovaries, breast, rectum, prostate, depression, gallbladder diseases, gynecological problems, infertility and irregular periods, heart diseases, liver diseases, and there are so many skin problems like impaired wound heating, sleep apnea, stroke, etc. Disadvantages of the obesity are the person who is obese can't do activity easily, feel uncomfortable, funny character for others, health problems like BP, sugar, arthritis, depressions, and problem of to choose the favorite clothes and especially footwear. Problem to react immediately, generally, or in the natural problems like earthquakes, storms, fire and flood. The obese person can't move immediately. In employment, for instance, if physical education teachers or dance teacher is obese, he or she can't give proper demo. Problem to fit in the normal furniture, even in the vehicle. The person, that kind of person can't enjoy the family functions also. He or she faces a problem to fit in the normal furniture and the vehicles. How we can diagnose obesity? Your doctor can review your weight history by calculating our BMI. Individually whose BMI is between 25 to 29.9 kg termed overweight, as I earlier told. Measuring your waist circumferences, the women with the waist more than 35 inches and men with waist more than 40 inches are obese persons, and they may have more health risk people with the smaller waist measurement. Laboratory test also diagnoses the obesity by complete blood count, CBC, bone fats, cholesterol levels, liver function test and thyroid test. Heart test also diagnose the obesity. General physical exams, which includes the measuring your height, weight, heart rate, blood pressure, temperature, and listening to your heart and lungs and examining your abdomen. The simplest way is that if you are not fit in your normal furniture of your house, then you consider yourself as obese. Stand straight and try to look at your feet. If you are unable to see your feet, you are obese. Pinch your skin somewhere, that is arm, leg, stomach, etc. If the skin doesn't come into your hold, you are obese. So what to do to overcome the obesity? A step for eating: eat to live, not live to eat. Breakfast should be like a king, lunch should be like a princess, and dinner should be like a cobbler. Eat small quantities of food containing balanced diet elements. Eat slowly and chew the food well. Avoid the oily and high fat food. Avoid to eat fast food. Don't skip the food. Be sure to have a good breakfast. Doesn't go long hungry. Use leafy vegetables in your food. Drink lemon juice, sugarless fruit squash, and plenty of water. Avoid much sugar, that is sweet diseases. Especially for mothers, don't eat extra food which is left by their kids. Try to drink warm in winter and lukewarm water in the summers. The weight controls by the exercise, we can say that exercise is regarded to be a magic bullet. In medicine, regular exercise is an important part of the healthy lifestyle and to maintain a healthy weight. Benefits of exercise. Exercise reduces risk of heart diseases. It reduces the abdominal fat. Exercise increases the lung capacity. It increases the muscular efficiency through greater blood flow. Conscious deep breathing during exercise is most supportive in expanding heart of muscles. 20 to 30 minutes moderate exercise 5 to 7 days a week. The standard recommendation for the people who are overweight should exercise at least 150 minutes per week. But subsequent research suggests that instead of 150 minutes, 200 minutes per week will be achieving greater weight loss. Distance running dropped body fat to 14%. Aerobic exercises also help to reduce the obesity. So we can recommend the exercises for the older obese are: follow diet and exercise program for the weight loss. Aim to exercise 3 days per week initially, which should be gradually increased. One should exercise initially 30 minutes, that is 10 minutes of the cardiovascular activity as walking on the treadmill, stationary cycling, 10 minutes weightlifting, 10 minutes flexibility exercises. Easy and general tips to keep away the obesity. We can say that one should integrate moderate exercise into one's lifestyle. Don't take tension, keep always the psychological problems. Park your vehicles at least half kilometer away from your office and go on foot. Take the dog for the walk and try to cope up with the speed of animal. Take the stairs. Carry your bags for the grocery to your car yourself. Do your work on. Don't use always remote to use the electronic gadgets. Take plenty of water and start your day at least with a glass of water. Mow your lawn with a push mower. Make a kitchen garden in your own home. Develop social circles based on the exercise. Walking in the morning, hopping and jumping. Organize activity-related camps, matches. Organize yoga shivers, engage the women more activities, stick the changes in the lifestyle, focus on the low calories, nutrition, dense foods, monitor your weight regularly. It will help you to keep your weight in control. Keep your clothes fit. Don't make it loose as you expand. Avoid use of drugs. Meal replacement plans help you lose your weight, that is such a low calories shake or meal wars, etc. Increase your daily activity. Don't reduce your weight less than 2 pounds per week because rapid weight loss is unhealthy. So at last, in conclusion, we can say that no matter what the cause, however, obesity can be prevented or managed with the combination of diet, exercise, behavior modification. Remember, Do the exercise for 150 minutes or 200 minutes per week, even if no weight lost. You will be obtaining the health benefits. Thank you so much.